Hello everyone, myself Dr. Neelam. I am working as a consultant pathologist at Dr. B. Lal Clinical Laboratory, Jaipur. So I am here to discuss a topic on advancing thalassemia diagnosis, the critical role of HPLC in hemoglobin analysis. So basically, what is thalassemia and what is HPLC and why it is important? So thalassemia carriers in India is over 35 to 45 million people, and the trait prevalence is 3 to 4% of general population. And some communities like Sindhis, Punjabis, Gujaratis, they may be as high as 8 to 10%. If we talk about the global burden, it consists of 10%, and so it is very important and crucial for the survival, quality of life, and prevention of the cases through the screening program. So early detection and timely management of the thalassemia is very important. So how can we diagnose it on a screening purpose? By HPLC. So we have a case of male patient of 2 years which who was presented with on and off fever with fatigue since 1 month. So he went to a doctor. Upon routine examination, his hemoglobin level was low. It was found to be 10.8 gram per deciliter, and RBC indices MCV, MCH, and MCSC were low with increased RBC count. So he was put on the nutrition therapy for around 2 weeks. After 2 weeks, but his condition remained the same. So later the doctor advised for the HP electrophoresis, that is HPLC. So what was the problem in that case? Even after giving the nutrition therapy to the patient, his hemoglobin levels remained on the lower side with increased RBC levels. So the diagnosis of this patient became elusive. So to find out the reason, if there is any genetic factor responsible for the condition or any hemoglobin variant is there or any other reason, the doctor prescribed him to do HP electrophoresis. So on investigation of hemoglobin electrophoresis, what we found is the child showed increased A2, A0 level, and F HbF levels are on normal side. So for this patient, all the controls ran during hemoglobin electrophoresis technique that were completely okay. There was no history of blood transfusion, and RBC counts were also on the higher side. So what is the interpretation is increased HbA2 levels along with increased RBC counts, which signified the presence of beta thalassemia trait. This is the diagnosis which detected by the HPLC method. So, what is the outcome for this case? The CBC and HP electrophoresis of the patient showed the presence of beta thalassemia trait, and but the question was from where the child has got the trait. So we have gone to reciprocally and we found that the father of the child's mother, that is nana of the child, got beta thalassemia trait, and the mother of the child's mother, that is nani, who got HBD trait, but his mother was compound heterozygous for the condition of HBD and beta thalassemia trait. So, what is the summary behind this? Only one beta thalassemia gene was passed to the grandson from the maternal side, like Nana to his daughter to his child. The beta thalassemia trait in the child, which was not major, this explains only one mutated gene was involved during this transmission from Nana to son. Even mother has HBD trait, but it did not contribute to the beta thalassemia trait because as the HBD variant is different than of that beta thalassemia trait. So, what we conclude is beta thalassemia trait was transferred from grandfather to mother and from the mother to its child So there must be some things which should be there, like mother must be the carrier of the beta thalassemia trait, and the child will be the carrier of the beta thalassemia trait. The father was normal, father did not contain any kind of carrier. So what we conclude is why is HPLC is important. HPLC is important in detecting these kind of cases, detection of the early thalassemia screening program. Also, it quantify the HbA2 and HbF level. Also, it is rapid, reliable, and quick method. Also, it can be used as a prenatal or neonatal screening, or you can also find your family planning kundli by this method. So, why it is a critical diagnostic tool? Because of its precision, speed, and ability to detect multiple hemoglobin types, enabling early diagnosis and appropriate clinical management. Okay, this is the hierarchy of the autosomal recessive inheritance. So we can find out here, the carrier parent got transmission to to their children, which was 25% of unaffected child, 25% of affected child, and 50% of the children got trait inheritance. Thank you so much.